Hey everybody, so you guys have probably heard of the medication called Benadryl or diphenhydramine. This is a medication that a lot of people use when they can't fall asleep, but in this video I'm going to be talking about why you should not be using the medication right before a big test. So before we get on to the rest of the video, I want to give a quick introduction of who I am. My name is Edgman. I'm a fourth-year pharmacy student, and I want to make videos about common questions patients ask pharmacists. So this will be a very informative channel for you guys. So if you guys have any topics you want me to cover, please let me know, and make sure to subscribe to my channel. Now to the rest of the video. So Benadryl, alongside other medications, are used for insomnia, specifically short-term insomnia. Benadryl is not meant to be used long-term, so the recommended amount of time we say for patients to use it continuously is about 3 to 4 days. However, Benadryl has a side effect of short-term memory loss. How does Benadryl cause memory loss? So Benadryl is an antihistamine, so it's an anti-allergy medication. It's also considered anti-muscarinic. So anti-muscarinic basically means anti-acetylcholine. Acetylcholine is a neurotransmitter in your body that has a lot of functions, and one of those functions is to create memories. And so when you're doing anti-muscarinic, anti-acetylcholine, that messes with the pathways in your brain that create memories. So if you're doing late night studying and then you take a Benadryl, which has anti-acetylcholine properties, it's going to impair your brain from forming those short-term memories. For all you crammers and procrastinators out there, taking Benadryl the night before an exam to help you fall asleep is not the best way of going about it because of the side effect of short-term memory loss. So if you've been like cramming all day, cramming all night, and you want to fall asleep, but you're too stressed because you're stressing for your exam, taking Benadryl is not going to do you any good because it's going to cause short-term memory loss. And so the next morning or next day when you're taking the exam, you're going to have a harder time recalling all the information you're trying to memorize the night before. I'm not saying you're going to forget absolutely everything you study, but it will be harder to recall that information. So what is my big pharmacist recommendation is? My number one recommendation is don't cram, don't procrastinate. No, I'm just kidding. However, for some cases, cramming and procrastinating is inevitable. So what was my recommendation? One is to try a supplement called melatonin. Although it is a supplement, like how we talked about how they're not regulated as stringently as prescription or over-the-counter medications, a lot of patients have reported positive benefits with sleep with melatonin. So I would suggest trying that over Benadryl because it has less side effects of memory loss. So that might be beneficial for you if you're trying to have a test the next day and trying to fall asleep. So that's the reason why you shouldn't be taking Benadryl the night before a test if you're cramming. If you guys like this video, please give me a big thumbs up. In the next video, I'm planning on talking about prescription medications for sleep and insomnia and how to increase sleep hygiene. So stay tuned for that video and comment below what topics you want me to cover and make sure to subscribe. Thanks for watching, guys.